Have you ever looked at your blood sugar numbers and thought, I'm doing everything right, so why isn't this getting better? You're not alone. Many people over 50 feel stuck managing diabetes. The medications help, the diet helps, but something still feels missing. Here's the thing most people don't hear enough about. Your body might simply be lacking a few key nutrients that quietly support healthy blood sugar. And once you understand them, things can start to shift in a very real way.
Today, we're going to talk about 3 essential vitamins that play a powerful role in helping lower blood sugar and A1C levels, especially for older adults. Now, this isn't about replacing your doctor's advice or throwing out your current plan. Think of this as filling in the gaps. As we age, our bodies don't absorb nutrients the way they used to. On top of that, certain medications can slowly drain important vitamins without us even realizing it. What this really means is even if you're eating fairly well, you could still be running low on the exact nutrients your body needs to manage glucose properly. So in this video, I'll walk you through 3 vitamins that matter most, why they matter, and simple ways to bring them into your daily routine without overcomplicating your life. And along the way, I'll share a few real-life examples so you can see how this fits into everyday life. Let's start with the first one, and this one surprises a lot of people.
Vitamin number 1, vitamin D, the sunshine support your blood sugar needs. Now, here's something most people don't realize. Vitamin D does a lot more than support your bones. It actually plays a role in how your body uses insulin, and that's a big deal when you're managing diabetes. As we get older, we tend to spend less time in the sun, and even when we do, our skin becomes less efficient at making vitamin D, so it's no surprise that many adults over 50 are low in it. Let me give you a simple example. John, a 68-year-old retiree, thought he was doing everything right, walking daily, eating smaller portions, but his blood sugar numbers stayed stubborn. After a routine checkup, his doctor found his vitamin D levels were very low. Once he started correcting that, slowly and safely, his energy improved, and over time, his blood sugar became easier to manage. What this really shows is that sometimes the issue isn't effort, it's missing support. You can get vitamin D from sunlight, certain foods like fatty fish, and supplements if needed. Even 10 to 20 minutes of sunlight a few times a week can make a difference, but always check with your doctor before adding supplements, especially if you're on medication.
Vitamin number 2, vitamin B12, the overlooked energy and nerve protector. Let's talk about another important factor, vitamin B12. This one is especially important if you've been taking diabetes medications like metformin for a long time. Here's why. Metformin, while helpful, can slowly reduce your body's ability to absorb B12, and low B12 levels can lead to fatigue, tingling in the hands and feet, and even nerve problems. Sound familiar? Many people assume these symptoms are just part of aging or diabetes itself, and sometimes it's simply a deficiency. Take Linda, for example. She's 62 and had been feeling tired for years. She also noticed numbness in her feet. After testing, her doctor found her B12 was very low. Once she addressed that, her energy came back, and her nerve symptoms improved enough to make daily walks more comfortable again. And that's the key. When your body feels better, it becomes easier to stay active, and that directly helps blood sugar control. You can find B12 in foods like eggs, dairy, fish, and meat, but as we age, absorption becomes tricky. So some people benefit from supplements or even B12 shots depending on their needs.
Vitamin 3, vitamin C, more than just immunity. Now let's move to something familiar, vitamin C. Most people think of it as an immune booster, but it also plays a quiet role in blood sugar balance. Here's the interesting part. Vitamin C can help reduce oxidative stress in the body. And when there's less stress at the cellular level, your body can handle glucose more effectively. It may also help reduce spikes after meals, something many people struggle with. Think about a typical day. You have breakfast, maybe some toast, maybe a little fruit. Then, a couple of hours later, your blood sugar climbs higher than expected. Over time, those spikes add up. Adding vitamin C-rich foods like oranges, strawberries, bell peppers, or broccoli can support your body in managing those swings more smoothly. It's not a magic fix, but it's a steady helper.
Let's connect the dots, why these vitamins matter together. Now, here's something important to understand. These vitamins don't work in isolation. Vitamin D supports insulin function. Vitamin B12 supports your nerves and energy. Vitamin C supports your body's resilience and balance. When all three are in place, your body has a much better foundation to manage blood sugar. It's like trying to run a car with missing parts. You can still drive, but it won't run smoothly. Once those missing pieces are restored, everything works better together. Simple ways to start without overthinking it. Now, you might be wondering, where do I even begin? Start small. Pay attention to how often you get sunlight. Look at your meals. Are you getting a mix of whole foods? If you've been feeling unusually tired or dealing with nerve discomfort, it might be worth asking your doctor to check your vitamin levels. This doesn't have to be complicated. In fact, the simpler you keep it, the more likely you are to stay consistent. So let's bring it all together. Managing blood sugar isn't just about cutting sugar or taking medication. Sometimes it's about giving your body what it's quietly missing. Vitamin D helps your body use insulin better. Vitamin B12 supports your nerves and keeps your energy steady. Vitamin C helps reduce stress in the body and supports balanced glucose levels. These aren't quick fixes, but over time, they can make a meaningful difference in how you feel and how your numbers look. And more importantly, they can help you stay active, independent, and full of life, because that's really what this is about. If you found this helpful, consider subscribing. I share simple, practical tips like this to help you stay strong, healthy, and confident at any age. And if you know someone who's struggling with their blood sugar, feel free to share this with them. Sometimes the smallest piece of information can make the biggest difference.